Hi Sam, how are you today?
Good, how are you?
Good. All right, I'll have you just confirm your last name and your date of birth for me real quick.
Morgan, 11/25/1997.
Okay, excellent. So it looks like today we're going to be doing a pretty extensive exam here. I'm going to be getting a set of vital signs, as well as a general survey of how you're doing, listening to your heart, lungs, as well as checking your peripheral vascular system, and checking your head, ears, eyes, nose, and throat. Okay?
Sweet, sounds good.
As we move through the exam, if you have any questions, please stop me at any time. Okay?
Good, thank you.
All right. So it looks like my medical assistant did grab some vital signs on you. I see a blood pressure of 120/80, which is normal. A heart rate of 62. Respirations of 12. 99% on room air, which is good. Means you're perfusing well and breathing at a normal rate. And a temperature of 96.7, which is afebrile. Excellent. Did notice that she did grab a weight and a height. You're about 175 and about 6 feet. So that puts you at about the 22-21 BMI range. Healthy weight. I'm not concerned about obesity and I'm not concerned about malnutrition.
Good.
All right. So as far as your nutrition at home, do you feel like you get a pretty well-balanced diet?
I would say so.
Okay. And then exercise, you feel like you're exercising regularly?
I would say about 3 to 4 times a week.
Excellent. With that 3 to 4 times a week, how often do you say you're incorporating cardio?
Maybe 30 to 40 minutes of
Okay.
a week.
We'll want to bump that up just a little bit. We want to get at least 60 a week,
60
okay?
minutes a week, okay.
All right. And then any stress at all currently?
No, just normal life stress, yeah.
Okay. You feel like you have a good support system at home?
Yeah, very supportive.
Okay. And then as far as that stress that happens, do you feel like you have good coping mechanisms for that?
Yeah, I would say they're pretty appropriate. Like
Okay.
going for a walk, getting
Okay.
some exercise.
Great. Always good to incorporate exercise to cope with stress, so that's good stuff to hear. No harms or no thoughts of harming anyone, like you or or anyone around you?
No thoughts of harm.
Okay, great. All good things. So we're going to go ahead and get started on your physical exam here. Just going to kind of wash my hands real quick here. Any concerns on the scalp at all today?
No
Spots of
concerns.
concern? All right, I'll start from there. All right. I'm not seeing any lesions, bumps, scaling, flaking, or any infestations on the scalp, which is good. Your hair feels resilient. The only thing I am going to note here is that through this both temporal regions of the scalp, you do have a little bit of thinning, or what we call androgenic alopecia.
Okay.
Very common in young men as we get older, okay?
Okay.
All right, and then next I'm just going to have you look at me real quick. I am just seeing some lentigines of the face. Do you have a family or personal history of skin cancer?
Family history of skin
Okay.
cancer.
All right, good reminder to just use SPF when you are in the sun, okay?
Okay.
Just looking at your eyebrows here, they appear symmetric. Your eyelashes look good. I'm not seeing any sparsity in the lash line, so excellent. Any itching, burning, or irritation from your eyes at all?
Nope.
Okay. Just going to double check here your sclera of your eyes. So looking at the whites here. They look white. I'm not seeing any redness or irritation. And then just going to push down here, and your conjunctiva look pink. No redness, swelling that I see on exam today, okay?
Okay.
All right. Next, I'm just going to check your pupillary reaction just to see if your pupils are adapting well. And then you're not wearing any contacts, glasses that I should know about?
Nope.
Okay, perfect.
No contacts, no glasses.
All right, just wiping down some of my equipment here.
Oh, okay.
Okay. All right, wiping it down. I am going to shine this light in your eye just to see how your pupils react, okay? So if you look straight ahead. Okay. All right, and then I'm going to have you look off into the distance here. Go ahead and look at the light. Off into the distance. And then go ahead and look at the light again. Okay, great. Your pupils are equal, round, and reacting to light in a combination. Excellent. Next thing we're going to do here is I'm going to check your extraocular movements just to be sure, make sure you're able to move and see out of your peripheral vision, okay?
Okay.
All right, I'll have you, with your eyes, just follow my fingers and keep your head and your neck straight, okay?
Okay.
All right, great. Extraocular movements are intact. what I am going to do is a vision test on you as well. All right, I'm going to have you read from the Snellen chart here the closest line that you're able to read, or the smallest, I should say.
EFTZO.
All right, now I'll have you cover your right eye. Do the same thing.
EFTZO.
All right, now go ahead and cover the left eye. And same thing.
EFTZO.
Okay, great. Looks like you have about 20/20 vision. That's good without any assistive lenses or anything like that. Next thing, I'm going to take a look here at the back of your eye. I'm going to shine a little bit of a bright light in there. It shouldn't be too uncomfortable though, okay?
Okay.
All right. And I might have to get a little bit close here. Okay. And then same thing on the other side here. Okay. Your disc looks sharp, intact. I'm not seeing any hemorrhaging or nicking, any concerns for retinopathy today, okay?
Good.
All right, so that's it with your eyes. We're going to move on to your nose here. Any history of facial fractures, nosebleeds, anything of concern today?
No.
Any sinus infections recently?
No.
Okay.
No sinus
I'm gonna
infections.
go ahead and press on your sinuses here. You let me know if you feel any pain or pressure.
No.
All right, and then up here, any pain or pressure?
Nope.
Okay. I'm going to go ahead and take a look inside the nose. Okay, good. I'm not seeing any deviation of your septum. Your nasal terminates look pink, open. I'm not seeing any polyps either, so everything looks good.
Good.
We're going to move on to the mouth now, okay? Same thing. I'm going to take a look inside the mouth. All right. Your oral mucosa looks intact. I'll have you say ah. Okay. Your uvula looks midline. Your plate or palate looks good. I'm not seeing any petechiae on there, and you have good dentition.
Nice.
Your lips look pink too, so it means you're perfusing well. I'm not concerned about any cyanosis. So all good things there.
Good.
All right. Next thing I'm going to do is take a look at your ears, okay?
Okay.
Any flaking, scaling that you've been having?
Nope.
Okay, and I'm not seeing any lesions, and same thing, not seeing any flaking or scaling. Commonplace for skin cancer, so always good to put sunscreen on those ears too. I'm gonna kind of pull on your ears a little bit. Let me know if you have any pain when I pull, okay?
Nope.
All right, how about here?
Nope.
And at your mastoid?
Nope.
Okay. Same thing on the other side. I'm just gonna pull at your pinna. Any pain?
Nope.
Okay. And your preauricular, any pain here?
Nope. Nope.
Okay, excellent. All right, and then just going to take a look inside of the ear real quick, okay?
Okey-doke.
Just going to wipe down my scope here.
When you say putting SPF on, what SPF is good or recommended?
About 30.
About 30.
Yeah, and try to reapply every hour.
Okay.
All right. So just going to look inside of the ear here, okay? Okay, so the ear canal looks pink. I'm not seeing, or your tympanic membrane looks gray, pearly, and intact, okay?
Okay.
All right, your canal looks pink, and your tympanic membrane looks gray, pearly, and intact, okay?
Good.
All right. All right, so next thing we're going to do is move on, or actually we're going to do a quick hearing test on you too. Any cochlear implants, I didn't see anything on exam either, so, or any ear tubes, anything like that, history of that. Okay, I didn't see anything. So we are going to do what's called a Rhines and a Weber test, okay?
Okay.
First one is going to check for conduction. So you let me know if you hear it on one side louder than the other, or if you hear it equally on both sides, okay?
Equally on both sides.
Okay, good. It means you have good lateralization of your hearing. Next thing I'm going to do, I'm going to have you tell me if you hear one is louder or two is louder, okay?
2 is definitely louder.
Okay, great.
2 again.
Okay. Good. That means that you're conducting your hearing more through the air rather than your bones. So that's always a good finding as well, okay?
Good.
All right. Next thing we're going to do is I'm just going to take a look at your thyroid gland. Or actually, we're going to palpate your lymph nodes real quick here, okay? So just going to palpate the submental lymph nodes, your posterior lymph nodes, and then your anterior lymph nodes. Any recent illness at all?
No.
Okay. Okay. Everything feels good. And then I am going to have you kind of sit to the side here. I am going to palpate for your thyroid gland. Any history of autoimmune disorders with you or your family?
Nope.
Okay.
No autoimmune.
All right. So I am just, you can keep your head still here. I'm just going to move this off to the side and palpate gently. Okay. Very good. We're going to do the same thing on the other side. All right, I'm not feeling any enlargement of that thyroid gland, okay?
Okay.
I'm going to have you drink a little bit of this water here just to assess it as you swallow, okay? Okay, very good. Feels like it's moving well. Next thing I'm going to do here is just take a listen to that thyroid gland and make sure I'm not hearing any bruise or whooshing of it, okay? Okay, I'm not hearing any bruise there, so that completes our head, ears, eyes, nose, and throat exam, okay? All right. So next we're going to take a look at your chest and take a listen to your lung sounds, okay? So I'll actually have you take your shirt off. Okay, excellent, and I can take that for you. All right, when I examine your chest, I'm not seeing anything abnormal. I don't see any use of accessory muscles. I do see a little bit of deviation in the middle of the chest here. This is called pectus excavatum. It's a genetic condition, and a little bit of an anomaly, but nothing to be concerned about at this time, okay? So first thing I want to do is just do a little bit of a test here, what we call tactile fremitus. Just listening for any changes in vibration when you talk. So what I'm going to have you do is just say 99 as I move my hands down your chest, okay?
99, 99, 99, 99.
Okay, excellent. Next thing I'm going to do is what we call percussion of the chest. So just listening for any hyperresonance, okay? Okay. I'm not hearing any hyperresonance in your chest or any concern for consolidation. All right, next thing I'm going to do is just take a listen to your lung sounds. I'll have you take some big deep breaths in and out. Okay, excellent. Next thing we're going to do are what we call some sound tests. These tests I'll just have you say a couple of words. I'm just checking again for that hyperresonance or change in pitch in your voice, okay? First one is called bronchophony. I want you to say the word 99 again for me as I move the stethoscope around your chest, okay?
Okay. 99, 99, 99, 99, 99, 99, 99, 99.
Perfect. Next one is called egophony. I want you to say the letter E as I move around the chest, okay?
E, 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 E.
Okay, perfect. Next one is I'll have you whisper the word 1, 2, 3, okay?
1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay, excellent. I'm not hearing any abnormalities when I listen to you. I didn't hear any crackles. Your breath sounded clear. So no concerns on the anterior part of your chest today, okay? I'm going to have you kind of switch to the side if you're able to turn around completely to the back here. And I will move this with us. Actually, yeah, we'll just go here. Okay. Again, I'm going to be doing that test called tactile fremitus. I just want you again to repeat the word 99 as I move down your chest, okay?
Okay. 99, 99, 99, 99.
Okay, good. I'm going to percuss the chest as well again. And then again, I'm going to take a listen to those long sounds, okay?
Okey-doke.
And then again, when I'm examining your chest, I'm not seeing any abnormalities, any use of accessory muscles, okay? When you're breathing in.
Okay.
I'll have you take some big deep breaths. Okay, excellent. All right, and then we are going to do those sound tests again, okay? So I'll have you say the word 99 as I move the stethoscope around, okay?
Okay. 99, 99, 99, 99, 99, 99, 99, 99.
Okay, and we'll go and say E.
E, 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 E.
Okay, and go ahead and whisper 1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Excellent. Just one more test I'm going to do here on the back. I'm just going to place my hands a bit lower here, and I'm going to have you take a big deep breath in and out. Okay, excellent. Everything felt symmetrical when you did that. All right, I'm going to have you move to the front here, and that completes our chest exam for now. We are going to move to the cardiac exam, okay? So we're going to take a listen to your heart sounds. When I look at your chest here too, I'm not seeing any heaves, thrusts, any signs of palpitation externally from a visual perspective, okay? All right, so we're just going to go ahead and take a listen to your heart sounds. I'm going to be listening with the diaphragm as well as the bell of the stethoscope today, okay? I'll have you lean just a little bit forward. Perfect. Okay. All right, excellent. So I'm hearing a normal S1 and S2 sounds. I'm not hearing any S3s, S4s, or any murmurs when I assess that, okay?
Good.
We do need to do this lying down as well. There's a couple other positions I'll have you do too, just to get better sounds of the heart, okay?
Okay.
I'll have you lie down. Yep, that one's fine. All right. So what I'm going to do here, just going to take a look, or take the back of my palm here and just feel for any chest thrusts, heaves, or lifts, okay? Nothing that I can feel on palpitation, okay? Again, gonna go ahead and take a listen with the diaphragm and the bell, okay? Okay, excellent. The next thing I'm going to have you do here is lay on your left side so you can kind of flip around and face towards me here. Okay. Okay, excellent. I am going to have you flip back over to your back there. We're going to just do the end of the assessment here for peripheral vascular system, okay? Okay. So looking at you on exam here, I'm not seeing any what we call jugular vein distension. I'm going to go ahead and feel for your pulses too, okay? So with the jugular vein distension just means that your heart is pumping adequately, okay?
Okay.
All right, going to feel your carotid. I'll have you turn that way. And then I'm going to have you turn the other way. And then I'm just going to feel your brachial pulses. And then your radial. And then I am just going to check the lower part here of your legs. Now, normally we would check the femoral. Are you able to push this up a little bit more?
Oh, yes.
There we go. Normally we would check the femoral pulses, but for decency today, we'll just bypass those. So I'm just doing the popliteal fossa, posterior tibials, and then your dorsalis pedis here. Okay, great. And then I'm not seeing any edema or concern for vascular congestion of the lower legs. All of your pulses felt +2 and equal bilaterally, so I'm not hearing any bounding, and I'm not hearing any weakness of any of the pulses today, okay? All right, you can sit up at the edge of the side or bed here. All right, so that concludes your exam for today. Just gonna fix this here. Obviously, if you have any further questions or concerns, please reach out to me, okay?
Okay.
Or if anything changes, of course. It was nice to see you today. I hope you have a good one.
Very nice to see you too. Thank you.